Calf cramps. The ones that grab you at 2, 3 in the morning. Your calf locks so hard you can't move your foot. And if you've been reaching for a banana on the nightstand thinking that's the answer, that's exactly where many seniors start going wrong. Because this isn't just a potassium shortage. And it's not random. Something specific is happening inside your body after 60 that most doctors never take the time to explain. There's a pattern behind these nighttime calf cramps. And by the end of this conversation, I'm going to show you why some seniors keep waking up with calf cramps even when they believe they're doing everything right, and the one potassium mistake that can make the whole problem more dangerous. Now, here's what most seniors have been told. You get a calf cramp, somebody says drink more water, or eat a banana, maybe stretch before bed. And that advice feels right. It sounds reasonable. You've probably followed it for years. However, and this is where the real story begins, guidance from the NIH Office of Dietary Supplements, from the Mayo Clinic, and from kidney care specialists tells us something very different. The real issue may not be whether you ate enough potassium today. It may be how your body is losing potassium, how it's handling what you do eat, or whether adding more could actually be unsafe for you specifically. That changes everything. And the reason you've never heard it explained this way is not because anyone is hiding it. It's because the advice never caught up. The system still tells seniors that nighttime calf cramps are just aging, or just dehydration, or just something a banana can solve. And that outdated, one-size-fits-all cramp advice, that is the real problem. Not you, not your age, the information. My name is Dr. David Collin, and this is for educational purposes only. Always discuss changes with your own doctor. I say that because what I'm about to walk you through today touches on medications, on kidney function, and on supplement safety. And I would never want you to make a change without your doctor knowing. That's not caution, that's care. If this kind of straight talk about minerals and cramps is useful to you, and I believe it will be, subscribe so you don't miss the next one. I cover the things seniors are living through, but too few people explain clearly. Your doctor never told you this, but I will. Now, by the time we're done here, you will know exactly why your calves keep locking up at night, what potassium actually does inside your muscles, why a banana may not be telling you the whole truth, and what you need to discuss with your doctor before tonight's cramps come back. That is the promise, and I don't break promises. So let's start with what's really happening inside your calf at 3 in the morning, because this is not mysterious. It's mechanical, and once you see it, you won't unsee it. Potassium is an electrolyte. That's a word you've heard. But what it actually means, in plain terms, is that potassium carries an electrical charge inside your body. And that charge is what makes your muscles work. Every time your calf muscle contracts, when you take a step, when you push off the ground, when you point your toe, potassium and sodium are exchanging signals across the wall of every muscle cell. Think of it like a light switch. Sodium flips the switch on. The muscle fires. Potassium flips it off. The muscle relaxes. That's the cycle. On, off, all day, all night. And when there's enough potassium, that cycle runs smooth. You don't even notice it. But when potassium drops, even a little, the off switch starts to stick. The muscle fires, and it doesn't fully release. It holds. It tightens. And at night, when your body is still, when blood flow to your legs slows down naturally, when you haven't moved in hours, that stuck switch turns into a full cramp. Your calf contracts so hard it wakes you up, and you're grabbing your leg in the dark wondering what just happened. The NIH Office of Dietary Supplements confirms that potassium is essential for normal muscle contraction and nerve transmission. The Mayo Clinic lists muscle cramps and muscle weakness as recognized symptoms of low potassium, what doctors call hypokalemia. This is not speculation. This is textbook physiology. But here's the part that gets left out. After 60, everything changes, and most people aren't told why. Your kidneys don't hold on to potassium the way they used to. Your appetite may have shifted, so you're eating less overall, and that means less potassium coming in without you even realizing it. And if you've had a stomach illness, diarrhea, or even a spell of poor eating, potassium can drop fast. Not over months, over days. A 2016 study published in BMC Family Practice found that among patients over 60 in primary care, the adjusted prevalence of cramps was 46%, nearly half, and 31% reported being woken up by cramps. That's not a rare complaint. That's 1 out of every 3 seniors sitting in a waiting room, and most of them never bring it up. So the pattern is this. Intake drops. The body's ability to retain potassium weakens. Nighttime conditions make the calf vulnerable, and the cramp hits. Not because you did something wrong, but because the system changed and the advice didn't. Most seniors never connect this to that. Today you will. Now here's where it gets more serious. Because if this were just about eating more potassium-rich food, the fix would be simple. But after 60, potassium problems are often not just a food problem. There is one category of medication that millions of seniors take every single day, and it quietly, steadily pulls potassium out of your body. I'm talking about diuretics. Water pills, the ones prescribed for high blood pressure or fluid retention. There are two types that do this. Loop diuretics, like furosemide, and thiazide diuretics, like hydrochlorothiazide. Both are on the NIH's list of medications that increase urinary potassium excretion. Both are confirmed by the Mayo Clinic as common causes of low potassium. And both are among the most widely prescribed drugs for Americans over 60. A review published in the Journal of the American Geriatric Society found that diuretic-induced hypokalemia is one of the most frequent electrolyte disturbances in older adults. And here's what makes this personal. You may have been taking one of these medications for 5 years, 10 years, and nobody connected it to your calf cramps at night. It's not that your doctor doesn't care. It's that the cramp conversation and the blood pressure conversation happen in different rooms, different visits, different mental folders, and nobody puts them together. But there's more. It's not just diuretics. Laxative overuse can drain potassium. Chronic diarrhea can drain potassium. Even heavy sweating on a hot day, potassium leaves through your skin. And if you're someone whose appetite has dropped, who's eating smaller meals, who's skipping lunch more than you used to, the potassium coming in is already less than what your body needs. Now let's talk about the banana, because I know that's what many of you were thinking the moment you saw this video. And I'm not here to tell you bananas are bad. They're not. A medium banana gives you about 422 milligrams of potassium. That's real. That's helpful. But here's the gap. According to the NIH and the National Academies of Sciences, Engineering, and Medicine, adult men over 51 need 3,400 milligrams of potassium a day. Women over 51 need 2,600. A banana gives you about 12% of a man's daily target. 12%. One banana is not a potassium plan. It's a start. And USDA Food Data Central shows us something most seniors have never been told. A medium baked potato, with the skin on, has 919 milligrams of potassium, more than double what a banana gives you. A baked sweet potato has 542. A cup of cooked lentils, 731. Half a cup of dried apricots, 755. The banana got famous, but it's not the best tool in the box. And relying on it alone, while losing potassium through medication or illness or reduced eating, that's the gap. That's where the cramps keep coming from. I want you to drop a letter in the comments right now. If you still believe calf cramps at night are mostly dehydration and one banana is enough, drop the letter A. If you believe there may be a deeper potassium loss or medication issue that needs a smarter approach, drop the letter B. I read every single comment personally. Now here's the part I've been building toward. And I need you to hear this carefully. Everything I've told you so far is true. Potassium matters. Food gaps matter. Medication losses matter. But there's something that changes all of it, something almost no one talks about. And once you understand it, you will never look at nighttime calf cramps the same way again. The real problem after 60 is often not that you never ate potassium. It's that your body is losing it, handling it differently, or, and this is the part that scares me as a researcher, making extra potassium dangerous. Let me explain what I mean. There is a group of seniors for whom taking a potassium supplement, or even using a salt substitute that contains potassium chloride, is not just unhelpful. It can be genuinely harmful. And that group is larger than most people realize. If you have chronic kidney disease, even early stage, your kidneys may not be able to clear excess potassium from your blood. The National Kidney Foundation states clearly that most people with kidney disease should not use potassium supplements. And many seniors have some degree of reduced kidney function and don't even know it. But it goes further. If you take an ACE inhibitor, medications like lisinopril or benazepril, or an ARB like losartan, these drugs reduce how much potassium your kidneys excrete. They keep potassium in. The NIH confirms that ACE inhibitors and ARBs can lead to hyperkalemia. That's dangerously high potassium. And if you're adding a potassium supplement on top of that, without your doctor knowing, you're stacking a risk. And potassium-sparing diuretics, like spironolactone, do the same thing from a different angle. They hold potassium in. So now you've got a senior who has calf cramps, assumes they need more potassium, buys a supplement at the pharmacy, and is already on a medication that prevents their body from getting rid of excess potassium. That's not a solution. That's a collision. I'm telling you this because nobody else in this space will. The supplement bottle doesn't ask about your kidneys. The label doesn't know your medication list. And the internet advice that says, just take potassium, doesn't know whether your body can safely handle more. This is not age. This is something your body is doing, and we can fix it, but only if we're honest about the full picture. Not just what to add, but what your body can handle, and what to ask your doctor before you make that decision. This is for educational purposes only. Always discuss changes with your own doctor. I want to be very clear about that, especially now, because what I'm about to give you is a 3-step approach to thinking about this the right way. Not a prescription, not a dosage chart. A way to walk into your next doctor visit knowing exactly what to ask. Step 1. Track the pattern. I want you to pay attention, really pay attention, to when your calf cramps are happening. Is it every night? Twice a week? Only after certain days? Write down what you ate that day. Write down whether you had diarrhea, skipped meals, or were sick. And critically, write down every medication you're taking, because the cramp pattern and the medication pattern may line up. And that connection is worth its weight in gold for your doctor. Step 2. Audit your food reality. Not your food ideal, your food reality. Don't just tell yourself, I eat bananas. Look at what you actually ate this week. Did you have potassium-rich foods spread across multiple meals? Baked potatoes, lentils, spinach, yogurt, orange juice? Or did you have one banana and call it done? The NIH data shows that the average American adult gets about 2,500 milligrams of potassium a day. The adequate intake for men over 51 is 3,400. For women, 2,600. There is almost always a gap. And knowing the size of your gap is the first step to closing it, with foods your doctor says are appropriate for you. Step 3, and this is the one that could protect you most. Do not self-prescribe potassium supplements without talking to your doctor first. If you have kidney disease, if you take blood pressure medication, if you take any diuretic, this conversation is not optional. It is essential. The National Kidney Foundation, the NIH, and the Mayo Clinic all agree. Potassium supplementation without medical guidance can cause hyperkalemia, which can affect your heart rhythm. That is not a small risk. That is a serious one. So to be clear, track the pattern, audit the food, and talk to your doctor before adding anything new. That's it. 3 steps. No guessing. No gambling with your health. And I want to say something about what this is really about. Because it's not about potassium. Not really. It's about the fact that you've been waking up in pain, in the dark, grabbing your calf, wondering if something is wrong, and nobody gave you a clear answer. That ends today. A 2017 review published in the journal Age and Aging focused specifically on nocturnal leg cramps in older people, confirmed that these cramps have a significant impact on quality of life, particularly sleep quality. And a review on Stat Pearls, the medical reference database used by physicians, notes that muscle cramps can result from multiple factors: dehydration, electrolyte imbalances, muscle fatigue, and underlying medical conditions. Not one cause, multiple. Which means one fix is never the whole answer. That's why the just drink water advice doesn't work. That's why the just eat a banana advice doesn't work. Because neither one asks the question that actually matters. Why is your body losing potassium in the first place? And can it safely take more? After 60, the right question is not, did I eat enough potassium tonight? It is, why is my body losing it, mishandling it, or reacting to it differently now? That question, brought to your doctor with your medication list and your symptom pattern, is worth more than any supplement on the shelf. And here's one more thing, and this might be the most important part of everything I've said today. If you have kidney problems, take certain blood pressure medicines, or use potassium-sparing medication, guessing with potassium is not a harmless experiment. The same senior who is vulnerable to low potassium can also be vulnerable to too much potassium if kidney handling is impaired or the wrong medication combination is present. That's the line. And it's a line you don't want to cross without your doctor standing next to you. Nighttime calf cramps after 60 are a signal, not a sentence. A signal to investigate intelligently, not guess emotionally. And now you know how to do that. But now that you understand potassium, why it drops, how medications drain it, and why the banana story was never the full answer, there's something else happening in your body that can make calf cramps come back even when potassium looks fine. Unless you also address that second mineral problem. And most seniors never connect the two. I cover exactly that in the next video. Watch it now.